Bismillahirrahmanirrahim. As I'm going to discuss the various topics about the MCCQE1 proportion, so gynecology and obstetrics, it comprises the high percentage of this exam, about 10%, and these are one of the high yield topics that we are going to take the brief overview of these topics and the scenarios that are asked of you, that you are expected to answer in the actual exam, and what are the important topics what you need to know in order to know these exams. So firstly, you need to review these topics from the Toronto notes. You can use your USMLE first aid as well, and you just have to have a basic guidelines or basic know-how about these topics. So it comprises the major portion, major system of the this exam, and you are tested about the diagnosis, various management steps, and the various emergencies. These are the prime part of the exam, including pregnancy, delivery complication, and the various gynecological conditions. What are the high yield topics in the obstetrics? So mostly it's asked about normal pregnancy, that what are the normal physiological changes in the pregnancy, that there is the physiological dyspnea, or there can be the physiological anemia that is normal in the pregnancy. They can ask you that if it is normal, or at what value it is abnormal, or it's pathological. Hypertensive disorders including gestational hypertension, chronic hypertension, preeclampsia, and eclampsia can be asked. Like various scenarios are given about them, and they can ask you about the diagnosis, about management, how, what is the best step in the management, what you are going to do, what are the investigations that are required, what complications can arise, what are the prenatal and the postnatal complications that can arise in case of hypertensive disorders. So hypertension and diabetes, like gestational diabetes, preterm labor, premature rupture of the membrane, postpartum hemorrhage, shoulder dystocia, and obstetric emergencies. Emergencies are the major topics because you need to firstly manage them, and they expect of you that you should know what to do with the patient when they are suffering from emergency, what are the best steps to take, and how doctor can avoid, or can prevent, or can reduce the damage occurring to the patient. So in case of these damages, these questions are further graded. Like new scoring system of the MCCQE1, it comprises mostly on the grading system. So the questions that are coming from the emergency medicine, or that requires the acute management, they carry more marks, because you need to know them in order to save the life of your patient. So gynecology and obstetrics, it further is divided into gynae and obs, and in case of obs, you need to know the obstetrical emergencies and the hypertensive disorder, gestational diabetes, and these are the most high yield topics that you need to cover. You need to first get their core concepts that you can have from your MBBS as well. You can review them from your basic book. You grab their concept, you practice these MCQs, and then you are going to inshallah ace this exam. After that, there are certain high yield topics in the gynecology, like a normal uterine bleeding. It can be due to the ectopic pregnancy, molar pregnancy, PCOS, like polycystic ovarian syndrome. It is really their favorite topic. And infertility, cervical cancer screening. Screening guidelines are the one that are more specific to Canadian healthcare system, and they are more particular about them, that when its screening is carried out, what screening method is used, and at how much interval you need that, and what abnormal findings need management. Endometriosis and chronic pelvic pain. Sexually transmitted infections are really common in various Western countries, and the pelvic inflammatory disorder, because it can lead to infertility as well. Now there are simple practice scenarios that I have included in these slides. So it's a 28-year-old woman at 32 weeks of the gestation. So whenever a pregnant woman is given, you can have the idea that it is coming from the obstetrics. So it's the 32 weeks of the gestation, like third trimester of the pregnancy, and presents with the severe headache, visual changes, and BP 170 by 110. So when the BP is 170 by 110, it means that patient is suffering from the hypertension, and there are visual changes, it means there is end organ damage that is occurring. Urine dipstick shows 3 plus protein. So when the proteins are coming in urine, it shows that protein, urea, edema. So when the hypertension is combined with proteinuria or visual changes and headache, this is the scenario of pre-eclampsia, as in the third trimester of the pregnancy. So the similar questions are asked of you. You need to know their diagnosis, like in this case this is pre-eclampsia, and what is the next best step in the management. You need to monitor the BP, and you need to lower down the BP with the labetalol, or there are various medicines that can be used as well, like in this case labetalol can be used. A 23-year-old woman presents with acute lower abdominal pain, positive pregnancy test, and hemodynamic instability. Transvaginal ultrasound shows free fluid in the pelvis. So whenever there is lower abdominal pain along with the hemodynamic instability is given and the pregnancy test is positive, it can be the ectopic pregnancy that has ruptured, leading to hemodynamic instability, and there is free fluid in the pelvis as well. So this is ectopic pregnancy. Like these scenarios can be given, and the answer is expected of you. What is the preparation strategy? You need to focus more on the emergencies, either both from gynae and obs, like PPH is the postpartum hemorrhage, ectopic preeclampsia, and you need to focus more on the Canadian guidelines and practice MCQs and scenarios under time condition using the Toronto notes and Canada Q Bank. Canada Q Banks are advised because they contain more specific guidelines, and there are more chances that similar scenarios can come in your exam as well. You need to know the red flags as well. When the red flags are given, then you need to manage the patient more cautiously in order to prevent the damage they are suffering from or to save their lives. Gynae and OBS contribute significantly to MCCQE1. So in order to ace this exam, you need to have the sound knowledge of these two subjects and particularly focusing on their emergencies. Applying the Canadian guidelines and practice scenario. This is all about, this is the main crux of the whole slides and of the whole file, that you need to start from where? Start from the book, practice MCQs. After grabbing their main concepts, apply those concepts, learn those guidelines, keeping the Toronto notes and Canada Q Bank as your practice scenario and as your practice Q banks. So this is a difficult exam, but you can achieve it by having a constant and firm knowledge. We are going to have more insights about this exam as well.